Social Security, the Social Security system that we hear about, that people are getting their Social Security in American street language, is really the old age survivors and disability system, OASDI. So it's made up of three separate programs: the old age system, into which people pay and receive benefits when they reach retirement age; the survivor system, which pays a benefit to people who've lost the breadwinner in their family in the middle of their life, children and spouses; and disability insurance, which we talked about in the last course, which provides support for people who are suffering major disabilities. Now, the single most important thing to understand the complexity of Social Security is that it is a pay-as-you-go system. It's key to really getting this. The money that is paid in this year is used to pay out the benefits for this year. And so that means that every generation is trusting the generation after it to pay Social Security. Now, this is not like the system, this is very like the system of children looking after their parents as they get older. And in this case, based on Roosevelt's idea from the 1930s, we as a society that are working look after seniors as they get older. And then the next generation counts on the same thing. And we've talked about the baby boomers early in this course and the expansion of the aging population that we're seeing, and then the baby bust. And so there was in 1985 a decision to build a larger trust fund to see us through this large population of elderly people and the baby boomers. And so people talk about the expiration of the Social Security Trust Fund. And this is based on this additional structure that was put in place in 1986 to pass us through the baby boomers. And we'll see in a little bit that it almost worked. The fundamental question here is one we've seen many times in the course. Should each person go it alone, or should we as a community support one another? And we pretty widely agreed that Social Security, and Medicare for that matter, are places where we're going to go it together. So it's financed by FICA. Everyone who works in the United States knows FICA. It's taken off your paycheck every week or every 2 weeks or every half month. And it is a 7.65 payroll tax from your work. And that is then matched by a 7.65 payroll tax from your employer. And that together creates the pool of money that pays Social Security. So 5.3% of what you pay in is designated for old age benefits. 0.9% is designated for disability benefits, and 1.45% is dedicated for Medicare Part A benefits. We'll talk about that in the next course. So this is also matched by the employer, and so there's a fairly large commitment there. So we decided early on that we were not going to pay Social Security on very high incomes. After all, we're insuring income so that it will continue after retirement. And so that we don't end up writing $5,000 or $10,000 or even $50,000 a month Social Security checks, we capped Social Security at an income that in 2018 is $128,400. So if you're making $150,000 a year, you will stop paying Social Security tax towards the end of October, because you will have paid your tax on the $128,400, and the rest of that will be not taxed. And so this is an issue that's going to come up later in the course in the discussion about Social Security. So you need 40 quarters to qualify. You have to have worked 10 years. A quarter is 3 months, and during that 3 months period, you have to have earned $1,320. So you can earn it all in one day. You can earn it spread over the 13 weeks. It's roughly $100 a week that you have to earn to qualify for a quarter. And once you have 40 quarters, then you you become eligible for Social Security old age insurance. Now, you'll find that there are certain people who don't become eligible, people who spend their whole lives working off the books, people who spend long periods of time in prison, or immigrants who arrived late in life, and they would not have the 10 years, the 40 quarters that would give them coverage in Social Security and also in Medicare. So there's a benefit for spouse and children, survivors benefits, and also pension benefits for spouses. There's a maximum family benefit. And because recognized and documented immigrants pay into the Social Security system, they're treated as participants in the Social Security system, and they receive Social Security checks for disability and for old age structure. So the benefits are based on contributions during your working. They're progressive. If you make more, you pay more and get slightly less back. And they're taxable, so that if your Social Security benefit brings your taxes to a taxable level, then you will pay tax on it. So the way it's calculated is there's an average monthly earnings, which are the top 40 quarters, 10 years of earnings you have. So those are created into an average, and then it's multiplied to create by the number of years you worked to create a primary insurance amount. And that decides the benefit. And a little bit later in this course, we'll talk about what benefit levels are.